Hello, everyone. Thank you very much for joining us today on this very important matter. I see many known faces here. I am glad to see you all here. And I am particularly enthusiastic to have some very interesting discussions today and participation and panelists accompanying me today on this fiscal transparency and participation for the emergency. So from those of you who do not know me, I am Lorena Rivero. I am a manager for technical collaboration and cooperation from GIFT. That's the Global Initiative for Fiscal Transparency. I am here with Sailendra Pattanayak. He is Deputy Division Chief from the IMF, who I'm sure they have a lot of work right now with all that's going on and this grants and loans to countries and everything that's going on. So thank you very much for joining us. And I have Lindsey Marchessault here, who is a director at OCP, at the Open Contracting Partnership. She has been supervising and leading the work in data of open contracting for a long time, and they do an amazing job doing that. I also have here Blair Glencorse, who is the executive director for the Accountability Lab. They do a lot of great work around openness, around participation, about engaging the community at grassroots, and something that that I really like of the work they do is not only highlighting the bad things, but also the good things that go on. And they have this accountability idol to highlight the public officials that are doing things right, not always the things that are going wrong. So thank you for joining us, Blair. He has a lot of background about this. And Jason Lakin, he is Senior Research Fellow at the International Budget Partnership. He does a lot of work around performance information, targets, and how to improve efficiency and effectiveness in government. So thank you, Jason, for being here. As you probably know, the International Budget Partnership is the organization that does the research on cross-country analysis of fiscal transparency. So thank you as well for joining us. So I am going to start framing some of the conversation. I'm going to start sharing my screen. So today we are reflecting on recommendations and reflections for fiscal openness in times of emergency. Why not just COVID? Because emergencies are happening all the time. This is not the first, this is not the last emergency that we're gonna have. And doing this research and this conversation once and again is not entirely effective or efficient. So we are framing this as fiscal openness in times of emergency and framing it in specific for COVID-19. Why COVID-19? Because it has a lot more implications, because it's global, because it's generating a lot of economic adjustments around the globe, and that makes it different. I know you joined already because you think that fiscal transparency in these times of emergency is important. I am not going to repeat that we need fiscal transparency to follow the money. And we already spoke about that a couple of weeks back. If you would like to read more about this, there's a link to the blog post and you can find it online on our website. But I do want to highlight 5 reasons of why openness is necessary in times of emergency. And this will give you an idea of why we have the presenters that we have today. The first one is to trace the design and implementation of measures, including the progressiveness and trade-offs. So it's not just about what measures are being implemented, but also how they are designed, and finally, how they are implemented on the ground. So to have an idea of trade-offs, and I have this very short discussion, and this has been a proposal that is definitely not a real thing, at least not yet. But this is the kind of trade-offs that we are facing right now as in the high-level decision-making. And the proposal, for example, in this case, is reallocate money from the Global Fund to fight AIDS and tuberculosis to fight COVID-19. So it's not an easy discussion that we're facing here when we are deciding at the international level or at the local level where the money should go, because we only have certain amount of resources that we can reallocate to certain different things. The second one is identify fiscal sustainability and flag potential risks. This is not something that we're going to find only in developing countries now. It's something that we need to discuss for all the countries, because all the countries are taking different measures in a higher or lower level, or the amounts might be different, but this is a conversation that needs to be taken in all the countries. The next one is improve efficiency and effectiveness, regardless of the origin of the funds. It doesn't matter if the funds are coming from aid, if they are from new taxes. We need to improve the efficiency and effectiveness of the funds we are using. The next one, and you probably came, or many of you might have come to this conversation thinking about corruption and mismanagement. And something that I wanted to highlight is that fiscal openness, it's not just necessary to prevent or detect corruption and mismanagement. It might be one of the objectives, but it is something to be aware of and to tackle and to protect against. So I have this very interesting video of how the cash transfers are being disbursed in Nigeria, and you see the packs of money there. So we immediately think, and what about the control on beneficiaries, right? So prevent or detect corruption or mismanagement. And finally, the fifth one is to make sure that measures that are meant to be temporary actually are temporary. So history suggests that most of the measures that are taken to combat crisis stay in place for a long time or for unaccounted time. And that is because we don't monitor, evaluate the progress. So we also need information around, for example, thinking of tax expenditures. For how long are they meant to be there? Are they reaching their objective? Are they not? And so this is another reason why we need fiscal openness in times of emergency. So these are the 5 that I have identified. Please, if you have more that you would like to share, and we can discuss them, because this is an initial conversation. And these reasons are important because they help us identify what information we need in order to achieve each of the objectives. And as you can see, we're going to need different information to analyze each of these objectives that we have. And a 6th one, having fiscal openness and transparency is also meant to enable public participation that is informed. So I have here 2 cases, and the National Treasury of Kenya that has facilitated an email to send proposals for the draft public financial management. Anyways, they closed it and published the Public Financial Management Act just one day after the public consultation was made. So it gives us also a question of how much is this input used. And we have a letter here sent by civil society from South Africa on the oversight and the role of Parliament. So this information is also meant to enable public participation in different levels, that it's informed. And we have precedents of this. We need information because it's hard to track. It's very complicated. We had the recovery.gov website. We had some natural disasters websites to track. And both cases have had a very hard time, even though they are made from government and tracking, implementation, and publishing from government. We see that they both have had very difficult time gathering all the information and all the data required to reach the objectives that were meant for it. And we also have precedents of this, of previous health emergencies. So we have a lot to learn from this, and I am glad to have Blair here because he has extensive experience on the Ebola crisis and the role of supreme audits as well. Where are we going and why this webinar? So we are starting the discussion to identify what is the most relevant information that we can have around fiscal measures and thinking about the whole range, emergency, stimulus plan, etc. And that is because we are going to keep working. This is not just a one-off webinar. We're going to keep working and having different engagements. And what we are seeking to achieve is to generate guides for governments to implement fiscal transparency in emergency responses. and specifically identify the data and data sets that are required to better follow the money in emergency responses. So that gives you a broad context of why we're here and why we have the presenters that we have here. And now I'm going to go to Sailendra so that he can share with us the perspective. So we're gonna start with the presenters, let's say from the most general topics to the most specific topics. So we're starting with the IMF with this overall general picture. And we're also gonna have some information about procurement after, about targets, and finally going on the accountability. So I am going to share the presentation for Sailendra.
Thanks, Lorena. So Sailendra here. So as Lorena said, maybe I'll give a very little bit general perspective before the other panelists are going to touch on some of the specific issues. So picking from what Lorena already mentioned, I will highlight three things. First of all, these unprecedented times when many countries are facing emergency spending needs, and where the money is going to come from. So that is the first thing, and where the money is going to go, which Lorena mentioned at the beginning. The second aspect is how transparently it should be done, in the sense that not just ex ante, but also ex post, how it should be reported and disclosed, all these use of public resources to meet these emergency spending needs. And finally, because countries are required to respond immediately, rapidly, without loss of time, so which means that there is a little bit of a trade-off in terms of ensuring ex-ante controls in the traditional PFM systems, which takes time. But so how can one fast track these types of expenditures, but at the same time ensuring that the mismanagement of resources or corruption is prevented. So these are the three aspects I'm going to very briefly highlight a little bit. So first is the funding mechanism to meet these emergency spending needs. I mean, most countries in the traditional PFM systems have some sort of contingency provisions. They could be typical contingency appropriations in the budget, which has been approved by the legislatures or parliaments. Some countries have a slightly different way in terms of having a dedicated contingency fund, which is replenished from time to time. So that is typically the traditional arrangement to meet with any contingency expenditure needs. So the issue here is, while this provision is there, the access to use these resources are generally regulated by very clear and transparent criteria. And also there are reporting requirements that all the drawdowns from these contingency appropriations or funds should be reported in a timely manner, both to Parliament and to the public. So that is the traditional arrangement. But in times like these, that may not be sufficient. So, which means that countries will be required to find savings in other, sectors or spending areas, and trying to reallocate those appropriations to previous one, to basically the emergency needs at this time. So this is generally allowed when the executive is given the power of their environment, what we call that they can reallocate between different budget lines. So they can move money from low priority spending items to high priority spending items. If that is not sufficient, for example, if the total allocation within the budget is not sufficient, you need more money, then countries are required to go back to the legislature or parliament with a supplementary budget proposal to more. And some countries have also a little bit of flexibility to handle emergencies like this. For example, in France, they have force majeure, where some additional flexibility is given to the executive or to the head of the state, to allocate money or even go above the total allocation in certain circumstances, like emergencies like this. But again, to regularize that after going back to Parliament. So these are the four arrangements to get the money. But the main important issue here is all these arrangements should be legally backed, and there should be, as I said, there should be clear and transparent criteria in terms of how to access these funding mechanisms, and there should be regular reporting of all the drawdowns and all the reallocations. Next, now coming to transparent reporting. This is very important as we are talking about fiscal transparency here. Now, at this time, many countries are taking coming up with different policy responses to the crisis. So some of these policy responses are maybe increasing allocations for health expenditure, for example, or on supplies and equipment, for example, supplies and equipment to hospitals, or maybe more goods and services in the health sector. But also, they're also trying to spend money to protect the vulnerable. To provide some financial support and fiscal policies to allow for this kinds of things. Now, whatever policies are responses are undertaken, there is always a rational or subject behind that, and that should be transparently disclosed. What if any policy is taken by the governments? They should report clearly what is the rationale behind that policy and what measure is meant for what. That should be clearly disclosed and clearly reported. And any policy, of course, has a cost. And as Lorena mentioned, time horizon. And it should not be entrenched that these policies remain forever, because these are temporary. Therefore, the cost and time horizon should be clear, should be made explicit. And of course, when I say cost, there are direct costs, but there are also contingent costs, which Lorena mentioned about risks. So these should also be identified and disclosed. And this is where the reporting is important. Reporting should be done in a regular and timely manner, and there are different elements of reporting. There's some of the things could be reported, the object of policy and the rationale of the policy measure should be reported, so the people and public know why the government is taking these measures. Whereas ex post reporting could be more granular in terms of specific what spend on for. Now, to enable all this, there is a need to establish a system to timely track all these emergency response spending. And there are different ways of doing this. And some countries actually establish a dedicated budget line. France has established a dedicated mission for this purpose. And in Francophone countries, there are arrangements like on the concours where they can do this. But even otherwise, the classification in the budget should be specified where this money is going to be allocated. And similarly, in the chart of accounts, when we execute the spending, it should track, the accounting system should track to be able to report this spending. Now, when I say reporting, just coming back to what should be reported. The reporting should not cover only the cash flow. It should be comprehensive and cover 3 types of measures. Why I say this? Some measures are reflected in the budget, so that therefore the cost is recognized and it has an impact on the budget deficit. Those obviously should be reported. But there are also many countries taking what we call opposite measures. And some of these opposite measures will have direct fiscal cost. That is, they may not be affecting the deficit directly, but they may be increasing the financing requirements. For example, a country may go for opposite borrowing, or maybe placing its assets, for example, future oil revenues, to pay for goods and services, which may not be affecting that deficit, but obviously it has a fiscal cost. So those are opposite measures with fiscal cost. But there could be opposite measures with contingent fiscal cost. For example, countries may provide guarantees to access from state-owned enterprises to secure or borrow. And so these may not involve upfront cash outflows, but there will be potential future spend. So the reporting should cover all these three aspects. I mean, not just budget execution reporting, but also all the objectives that are being taken. So finally, when this spending takes place, as I said, because countries need to rapidly respond to this emergency, so they may have to fast track some of the expenditure authorizations, which means that they might have to streamline some of the ex-ante expenditure control mechanisms. But this raises, of course, the tension between efficiency and controls, and also the accountability and the risk of abuse of mismanaging the funds. So therefore, balanced approach needs to take. Now, there are different ways of doing this. One could be like taking a risk-based approach, controls, so that control payments and relatively less risk payments could be subject. Some of the ex-ante and upstream controls, when you are relaxing, you may, to compensate that and strengthen the exposure. Countries have done it. For example, some countries have a set of committees which includes not just external audit, but also even representation of parliament, to have some external review exposed of these types of spending. So you then balance, relaxation at the ex-ante level by strengthening exposed. Audit institutions, particularly external audit institutions, and this is involved in the design and implementation of line controls. For example, in New Zealand, they set up a select committee of parliament was established, which is required to kind of oversee all these policy measures ex ante and then be involved in the monitoring of its implementation. So there are different ways of doing this by involving some, legislature and also the audit institutions. And finally, to ensure that these types of measures will not continue, and also they are actually fit what they're expected to deliver, some targeted audits could be helpful. In fact, after the first wave of payments are made using some kind of access, and then from that feedback from the and could inform improve further the delivery of these types of payment and supports to vulnerable citizens. So these are the three aspects I wanted to highlight. I mean, how to transparency of the process itself, but also transparency of reporting the ex ante, the policy intentions and the cost, and also exposed the actual spending undertaken. So I will end here, but I will be happy to take any questions. Thank you.
Thank you very much for that, Sailendra. Actually, as you can see, there are a lot of trade-offs, a lot of analysis that has to go into the reporting and strengthening fiscal transparency in this case. And next up, we have Jason.
Thank you. So good morning, good afternoon, good evening, wherever you may be. Thanks, Lorena, for organizing this, and to GIF for organizing this and for inviting me. I'm going to speak particularly about performance indicators within budgets and generally performance frameworks and their relevance, and maybe some opportunities in the current crisis, building a little bit on a couple points that Sailendra made. So I basically just want to make 4 key points. So the first point is that existing systems for performance frameworks, performance indicator frameworks around the world in program budgets and performance budgets, which have spread all over the world in recent years, are nevertheless fairly weak as we come into this crisis, and that poses a challenge. The second point is that I think the crisis, nevertheless, I think presents an opportunity, however limited, to strengthen processes around performance frameworks and performance review. The third point is that the new funding streams attached to stimulus measures and so forth of the type that Sailendra was discussing are an opportunity to introduce simple indicators and frequent review processes that can help to build a culture of performance. And related to that, the fourth point is that we should seek to have public ownership around indicators, and particularly around the review process of implementing indicators and reaching targets or not reaching targets, in order to build a greater, again, to build a culture of performance, as well as enhancing trust in government, which I think is low coming into this crisis, and of course very critical for the resolution of the crisis. So let me just say a little bit about each of these points. In terms of existing systems being weak, I think there's lots of literature on this, and we've been involved at IBP in developing, in carrying out a recent review with the World Health Organization, looking specifically at issues in low and middle income countries. But there's also literature from the OECD and so forth. And the basic question is, can a budget user understand the link between the money that governments are putting into the budget and what's supposed to come out and what is actually coming out? And frequently, in spite of the proliferation of indicator frameworks, the answer to this is still no. And this is because, in part, program and indicator structures are too highly aggregated. They don't go down far enough into the details. They often lack baseline information to allow us to assess whether targets are reasonable, and then over time whether they're being met. And while there may be indicators, a hierarchy of indicators, there's often a lack of narrative detail to explain the results chain, how something moves from an input to an output and so forth. And so this in part is tied to the fact that the understanding of these frameworks and their use is fairly limited. When we think about the stakeholders that are important, the public, the legislature, there's relatively low visibility for these performance frameworks and indicators. And then there's infrequent use of them to review performance, both at the end of the year, which is of course the minimum that we would expect, but also during the year as changes are happening. And supplementary budgets are introduced, environment is happening, and changes need to be made. So that's kind of where we're coming from. So why is this an opportunity to improve processes? Well, I think the first thing is that if we think about the problems that I just identified, one is low visibility and use of these frameworks, and this is tied to the fact that they're not as useful as they could be and as disaggregated as they could be. This is a moment where there's very high visibility on specific parts of the budget. So in the first place, we know that there's a lot of attention being paid to the health sector. New money is flowing into the health sector, and people are very attuned to the question of, if we're going to be spending money in the health sector, what is it that we're going to be getting for those funds? And so there's an opportunity to link are thinking about the budget to performance in a very direct way. It doesn't require a big leap for people. At the same time, there's also a challenge for other sectors where the issue is cutbacks. So money is going to be moved around or frozen to make funds available for other measures that were not anticipated. And that means that other sectors have to reduce the scope of what they had intended to do this year, and they have to tell us how they're going to do that and what it is that they're not going to be able to do. And so these two things together create an opportunity, I think, for a conversation where governments explain, agencies explain what it is that they had hoped to do, what they're not going to be able to do, what they're now going to be able to do that they weren't going to be able to do, and why. And we know that this is something which is not a one-off. This is something that's going to have to be, there are going to be repeated adjustments as governments try to figure out how to manage the crisis and as they determine its extent and how successful the measures that they've introduced have been. So this creates an opportunity for ongoing conversation. That what I just said is all about existing streams of funding. So the existing health sector maybe is getting new resources, but existing health sector, existing other sectors, but there's also a bunch of new money coming into the system to do fiscal stimulus, demand management, credit, and so forth. And here, I think the goal is to explain in simple terms what this money is for, and this connects to a point that Sailendra made about the rationale for spending, where possible, the number of beneficiaries that we expect to receive funding under certain schemes, and the expected results. And of course, there's a lot of uncertainty about some of these things, but I think quite a number of the policies which governments are adopting are amenable to some basic indicators around who's supposed to benefit, what we expect to happen. So if you think about wage subsidies, which is a policy which many governments have introduce a certain amount of money that's supposed to save jobs for X number of people who are at risk and should contribute to some reduction versus baseline or versus no policy where the number of jobs that we would expect to be lost. Now, of course, we'll get more information over time about how this is going. I think we've seen already the Swiss program, which is very successful. They've already doubled the amount of money going into this because there's been so much demand and it's been effective. But the point is to get these initial indicators and targets out and start discussing them. Just an example of some of the policies, I just grabbed this from the IMF policy tracker. This is from Bolivia. Just copy pasted some of the policies that Bolivia is putting in place, and you can see that there's already a couple things on which one could build some very simple indicators around how many families are going to be given how much of money over what period of time. And this, with a little bit of additional information, can be used as the kinds of basic indicators and targets, some of which are still going to be, yes, at the input level rather than getting us to our outputs and outcomes, but already starting to speculate about what we hope to achieve with these things, which would need to be added to what we have here from Bolivia. So my general point here is that it's most important to get some indicators and targets out with the goal of revising as we go and as we learn, rather than holding back and saying, well, we're not really sure exactly what we're doing. We're not really sure what the impact is going to be, because the goal is to start a conversation and begin to structure the discussion around policy. Ultimately, the question that governments are going to be asked is not just, did you deliver cash? If you introduce cash transfer programs to households or business, did you deliver cash? But did it make any difference? Did it save people's jobs? Did it help reduce the impact of the crisis? And so governments thinking about that should structure the indicators and targets that they're putting out so that when that moment comes, when we're starting to ask, well, did you achieve whatever you said? The question isn't some impossible, did you save the entire economy and the universe, but did you achieve some of the more limited things that you hope to achieve with each of these policies? So some form of output goals, I think, are needed, however rough. Final slide. My last point is that we need to think about how to engage the public in the review of these indicator frameworks. And this goes back to one of the earlier weaknesses that I mentioned, which is that performance frameworks only work if someone is paying attention to them. And that means somebody needs to feel a sense of ownership about them, the public, legislatures, et cetera. Now, under urgent conditions, people need to get money out. There's not time to go back and do 6 months of participatory work to come up with indicators and frameworks, but a commitment can be made at the time that policies are being introduced with their indicators and targets to have review of those and to invite public comments into the review process and make sure that that actually happens as we go so that we begin to create this culture. Again, the point is not to get everything right at the beginning, but to create opportunities for conversation. And then we can structure debate through various technical fixes using both the media and then online and so forth, virtual discussions to do that. Not perfect, but I think that there are things that could be done to bring the public into these discussions, and again, helps government to structure expectations around what policy can achieve. So in conclusion, I think that the opportunity here is, this is not the time to develop sophisticated new indicator frameworks that go beyond anything that we've ever done before, but it is a time to create greater visibility around our existing frameworks, introducing some new, simple, and flexible indicators around new flows of funds, introduce and institutionalize frequent review processes where we get to discuss whether things are happening or not, and people are made aware of what these indicator frameworks are about and why things are not going the way they're supposed to, and institutionalize transparency and build public ownership. And these things are, again, the kinds of things that are needed to make performance indicators work well all the time, not just in crises, and our weaknesses. And that's why I think that there is an opportunity here in this crisis to sort of build that link, and particularly the process review part of the relationship between budgets and performance. So let me stop there.
Well, thank you very much, Jason, because this is a very important topic, because we are always hearing about the stimulus plans and fiscal sustainability and debt, but we're not hearing enough about performance and what is the value for money of what we're getting, and not just in the immediate response, but also in the post-stimulus plans and so forth to reactivate the economy. So this is a topic that we thought it was very important to bring up to the conversation, because we don't feel it's sufficiently there yet. So thank you very much, Jason here. Now we're over to another way of seeing efficiency, which is around public contracts. And that is a very important side of this, in a way of seeing how public contracts are managed, is a way of seeing also efficiency and effectiveness of a part of the implementation of the budget. So just give me 1 second. I am really sorry for what's happened in the chat. We have closed the chat. Unfortunately, we have to take a bit of measures, and we are very sorry for what happened there. There have been a couple of bots coming in, so we are here now taking the action. So, okay, Lindsey, over to you.
Thank you so much, Lorena, and thank you so much, Sailendra and Jason, for your wonderful, wonderful remarks and slides. So I don't have slides today, and while I'm very happy the chat was disabled against the Zoom bombers, I'm sorry that means that we can't have more of a dialogue together. But basically, I'm here to talk about the importance of public procurement and openness in the fight against COVID-19, because public contracts are what is going to convert, in most cases, the budgeted money into the impact that we're looking for. And really, I think what we're seeing is that the fiscal impact of COVID-19 will be unprecedented. And so in these times, we want to make the most out of the limited public money that we have to effectively fight the virus, to protect our populations, and of course, to rebuild our economies when we're coming out on the other side of this. At the Open Contracting Partnership where we work, I work with governments and their stakeholders to implement data-driven reform projects that improve the effectiveness and fairness of government contracting. And over the last 5 years or so, our work with our partners has shown that open contracting reforms can make a big difference when they're done right. And by that, I mean when there's timely, high quality open data, when businesses and civil society have a voice, and when the government has an ear to listen. In those situations, open contracting has led to significant savings and improved services for citizens. And now that COVID-19 has put the world in crisis mode, governments at all levels are mobilized to purchase the urgently needed medical equipment and other supplies and services that are needed to fight the virus. Unfortunately, the situation is exacerbating many of the pre-existing challenges that have faced public contracting systems for many years. Low levels of transparency, low levels of digitization, poor coordination are creating kind of a Hunger Games-like scenario as hospitals, public health agencies, subnational and national governments are competing with each other for essential equipment, medicine, and services. And in many cases, procurement agencies may not even know what they need to buy. We've seen cases of stockpiling items that ultimately won't be that useful instead of the items that are the most needed. And unfortunately, there are some bad actors out there who may be taking advantage of the chaos to enrich themselves at the expense of the public and ultimately medical staff and patients. We've even heard some examples of fraudulent suppliers selling counterfeit goods. So even in normal circumstances, it is estimated that corruption inflates the costs of public contracts by an average of 10 to 25%. So now that we have huge public spending committed to fight the disease, it's more important than ever that public contracting deliver value for money. So I'm going to share some concrete examples of what can be done to help. We actually had a community call last week where over 150 reformers joined in to share their experiences, and a few key lessons emerged that I'm going to try to summarize for you all now. The first was around the policy response. So COVID is requiring governments to move more quickly than the legal frameworks typically allow. So several governments are passing emergency decrees and measures to enable more agile procurement. And this is a good thing, but the best examples are the ones that also include some measure of centralization or method of coordinating procurement to ensure that the supply gets to where it's most needed, and the measures that still include transparency requirements. For example, the Ukraine emergency procurement rules allow direct purchases with very little red tape, but the data must be recorded in the system and published by the next day. The second theme was around coordination. As mentioned, the worst examples are situations where hospitals, agencies, different governments are bidding against each other for limited supply. Coordinating and centralizing demand can help to manage supply chains, as can effective dialogue with the market. Canada, for example, demonstrated agile engagement with the private sector by publishing an open call to potential suppliers of the key products and services needed to combat COVID-19. This call is being well publicized and hopefully will help the federal government, as well as the provinces, cities, and hospitals, to find the new suppliers who can help provide the needed goods and services. The third thing, and what's very central and important to this conversation, picking up from the reporting requirements that Sailendra and Jason were both talking about, is having good open data. Having good open data helps with coordination. It makes it faster to do market research and due diligence, and it assists with supply chain management. Those who are already using the Open Contracting Data Standard are doing a much better job in this regard. Both Paraguay and Ukraine have added COVID-19 as an identifier to their published open data as part of the procurement method rationale field. And I think very relevant to the gift audience, Paraguay has a dedicated budgetary identifier for the contracts that are funded for COVID-19 response. So this is a fail-safe to ensure that all contracts related to COVID-19 are documented as such in the data set. For those who may not be aware, the Open Contracting Data Standard is a global, non-proprietary schema for publishing data about the planning, procurement, and implementation of public contracts. It's being implemented by almost 30 governments around the world. And we're currently developing a short guidance document outlining the most essential data to collect and publish for COVID-19 emergency procurement. Sorry about that. The final theme that emerged was about data use and procurement monitoring. So with good data, we can compare prices, we can compare the performance of different suppliers, we can identify red flags, and we can use these insights to quickly adapt our planning, procurement, and contract management processes to improve outcomes. My colleague at OCP, Camila Salazar, has already produced a guide to how to use open contracting data to monitor COVID-19 response procurement. And this is already proving useful to some of our partners, for example, to analyze the market for the supply of several different types of medical masks. But medical equipment is not the only issue that's important to monitor. For example, Jason's colleagues at the International Budget Partnership are doing really great work with other stakeholders in South Africa to ensure clean water, sanitation, and refuse removal to slow down the spread of COVID-19 among South Africa's 5 million informal settlement residents. And they're doing this by monitoring the performance of waste and sanitation contracts. I was going to share some of these examples in the chat, but if any, maybe I'll share them with Lorena afterwards and they can be circulated to the participants. But kind of moving forward, I wanted to talk about what's going to happen next, because with the fiscal and economic challenges that are coming around the corner, improving efficiency and value for money in public contracting is going to be mission critical. When facing severe budget shortfalls and an economic recession, savings need to be found somewhere, and public investment needs to lead to that economic improvement. So that's why it's vitally important that we invest in the reforms that are needed now, not only to respond to the crisis, but to start identifying what needs to be procured to restart our economies. So it's imperative that procurement planning becomes more agile and coordinated. You know, what do we think we need? What are the desired outcomes? Who will be the most affected? What options could be leveraged to address these needs? Is it appropriate for a small business? The more planning that can be done transparently in consultation with stakeholders in the market, the better the resulting procurement will come. Secondly, complete procurement records need to be published as real-time open data and documents. In particular, it's important to publish information about the planning of public contracts. This way you're signaling your need to the market and can get feedback on the potential solutions. It's also really important to publish data and documents about the implementation of public contracts so that we can know whether they actually delivered their intended value. Finally, as Paraguay and Ukraine have done, funds that are mobilized for COVID-19 and recovery funds should be noted with clear identifiers to help us track the use of those funds. Finally, government, academia, media, business, and civil society all need to be mobilized to analyze this data, to identify where procurement is not meeting the intended needs, and the further reforms that are necessary to ultimately improve value for money, market fairness, integrity, and efficiency. The good news is that each reformer does not need to reinvent the wheel. There are global resources out there that are free to use and adapt, like the Open Contracting Data Standard itself, the related tools and methodologies for data publication and use, and even some proven tactics and templates for designing reforms and the change management process that leads to their successful implementation. Again, I'm happy to share a link to some of these resources with Lorena to circulate after the call. And if anyone is wondering how they can get started, please do not hesitate to get in touch with me. We could continue this conversation over Twitter or email if we can get in touch with each other. Thank you so much.
Thank you very much, Lindsey. And something that we can do is, if you can share the examples, we can start posting them on Twitter as a follow-up this conversation on the webinar. So anyone who's following us on Twitter, also, if you want to send the questions directly from there on Twitter, tag us and we can interact on Twitter chat, finding options in this case. Thank you very much, Lindsey. I would like us to stay with the real-time data. Now it's possible not just for procurement, but in general of the budget reallocations, because we have financial management information systems that allow to a certain extent to do this. In some countries more, in some others different, and it's gonna depend on different data sets, what we can do. So that is a possible thing. And as well as a great idea, this identifiers of contracting that has to do with COVID-19. And thinking about emergency responses, that would be a general measure for emergency response, for example. And we can start implementation right now and carry on. So that was part of the context of thinking about this in general emergency context and how COVID-19 is driving us to do this kind of reforms. So thank you very much, Lindsey. It's a great input. So now we're off to Blair Glencorse. He is also not going to use any presentation, but he has so much experience that I am looking forward to this. Thank you. I have unmuted you.
Okay.
Yeah.
Great. Thanks, Lorena, and thanks to everyone else for the really useful and interesting comments. I run an organization called the Accountability Lab. We find creative ways to build accountability around the world, and we have teams in Liberia who were there all the way through the Ebola crisis, as Lorena pointed out, and in Nepal. So we also worked quite a lot around the earthquake response there, and I think there's some interesting lessons from that as well. And we also happen to be leading the C20 anti-corruption working group this year, which is putting forward policy suggestions to the G20 on anti-corruption issues. And of course, the response to the coronavirus is a big piece of that. So I'll touch on on a few of these different things. So what I thought I'd do to begin with is just give you a bit of background on all of this, which many of you know, of course, but the first point is that corruption, of course, is pervasive. Even in normal times, corruption guts health systems. Significant amounts of public procurement are lost to fraud and graft. And now, of course, this conversation is important, but we should be having this conversation constantly. In the middle of a crisis is not the time for us to be thinking about how to create new management systems. We should have thought of this before, of course. The second point there is I think we're dealing with institutions globally that are not fit for purpose. I was looking through some of the reviews of the World Health Organization's accountability today in preparation for this. All sorts of reviews that in quotes, talk about the legendary misspending of the World Health Organization. There was one last year in which the Independent Oversight Service of the WHO, which is the independent entity that is supposed to monitor the WHO itself, was condemned as biased and susceptible to influence. So we are operating now in a situation where we have trillions of dollars going into government and multilateral organizations and systems with inefficient and substandard oversight mechanisms. So the fiscal governance implications of all of this are, of course, hugely significant. I think we're also obviously dealing with a massive lack of leadership at all levels. And if you look at some of the key reports from other global emergencies and disasters, for example, the commission that looked into Hurricane Katrina in the US, leadership is absolutely critical, and it's missing. In Nepal, for example, with the National Reconstruction Authority after the earthquake there, it was a textbook example of how mandates were confused, leadership was overlapping, leaders, even at the top of the institution, were found to be corrupt, lines of responsibility were not clear, and as a result, the response was a disaster in itself. So, of course, we need leadership at all of these levels and leaders that really understand fiscal governance issues. But there's also a mutual dependency, I think, which bequeaths a mutual lack of accountability. For example, in Liberia, before Ebola, everyone knew that financial management systems were not great, that they were well below international standards. But USAID, for example, still put lots of money through government systems, subsequently did an audit. We've talked about maybe when those compliance mechanisms and audits should take place. This was ex post. Lots of the money, $10 million, went missing. But USAID continues to work with the government and continues to put money through the government. And I think we need to be honest here about, in these kind of situations, if we're talking about potential donor support to governments around the world that are dealing with coronavirus, that there are power dynamics and that there's mutual dependency here. And we need to understand how that might affect the accountability that we're calling for. So there are all sorts of technical fixes, many of which we've heard about, of course, to some of these challenges. And these are some of the things that we've suggested in our policy paper to the G20, which we've just drafted. So, of course, transparency, complete transparency of all coronavirus funds, according to open data standards, with contracts and disbursements that include anti-corruption clauses and that are fully open and accessible to the public. Full oversight and reporting on the funds. I was looking at some of the details around the spending in Haiti after the earthquakes there, which are now over 10 years ago. And Paul Farmer was recently tasked with following up on the aid disbursements to see how much had actually been dispersed. And 6 of the 10 top government donors who responded to the Haitian earthquake refused to provide figures on that, including the IMF, incidentally, Sailendra, and the USAID and Canada and other donors who we expect should be transparent and open are not even releasing the most basic numbers on how much they're spending on these sorts of emergencies. That has to change, of course. We need oversight boards to oversee the management and reporting on stimulus funds and on health spending. We need support to inspectors general and relevant government accountability offices to assist government entities in oversight. We need whistleblowing protection, of course. We need audits of all funding, but with the recognition that not all countries have the capacity to do these sorts of things. Auditing, for example, Liberia, after the Ebola crisis, was only able to audit a very small fraction of the amount of money that came through its systems, about 15 million. And it found, more than 10% of that money had gone missing. So there's a point to be made here, I think, about not just channeling money to fight this pandemic, but also understanding that there are other kinds of resources that are necessary and that need to be built. And the capacity to build public financial management systems is one of those. Beneficial ownership, of course, all contractors and subcontractors throughout this process who are receiving money related to coronavirus should be required to provide beneficial ownership information so that we know who owns these companies. But again, this agenda hasn't moved nearly as far as it could have done in many developing countries in particular. And finally, the point that's been touched on previously too is that we have to give citizens the ability to monitor and to oversee all of this. And of course, that is difficult now at a time where we can't meet each other in person, but there are ways that we can do this, and many creative solutions that countries are already finding. WhatsApp channels, online town halls, virtual city council meetings, all sorts of things. But I'll talk in a moment about how to perhaps make those a little bit more inclusive. And so I think there are a few bigger issues that come out of all of this. There's some technical fixes that I mentioned, but bigger issues that I am thinking about and would be happy to hear feedback about if we're able to do that without the chat. One is that transparency, of course, does not equal trust. It's important to make all of this information transparent. It's important to map where money is going. But there are all sorts of challenges with that process. As we've heard, data is often incomplete. The sustainability of these efforts is always questionable. I've looked at many of the kind of follow the money type websites after emergencies globally in the last 5 or 10 years. Very few of them continue updating after 2 or 3 years after the emergency, when of course that money is still unaccounted for and there's still much of that money still being spent even decades afterwards. And part of building trust, I think, is understanding who needs information. And this is a point that Lorena has made previously in blogs. Is it government agencies? Is it responders? Is it citizens? And so working out who needs this information, disaggregating it in that way, and then communicating with them in ways that build trust. And that, I think, comes to a second point, which is about partnership. Governments are not the most trusted actors in many countries around the world. Trust is in short supply. They're not necessarily the best placed to deal with the coronavirus. Here in Pakistan, for example, we have a provincial government in Sindh who is actually saying to people, don't give us money, we are corrupt. The best thing to do is to work through our partners. For example, there's an amazing organization here called the Citizens Foundation, which runs schools. There's another health NGO called ED, which runs an ambulance service. These are much more trusted institutions in Pakistan than the government. But the government has realized that it can partner with these institutions to deliver supplies, to run ambulance services and so on, in a way that people will agree to and will trust much more than if the government did it itself. So partnerships are absolutely key. Of course, I think the third point, and this was touched on earlier, is we have to make this inclusive. We have to find ways to engage people creatively around these efforts. One thing we did in Liberia during Ebola and subsequently was interactive murals in public spaces. Of course, everyone isn't online. It's great to have websites, but we translated those into very simple drawings and paintings on walls, and then brought in intermediaries who would engage citizens in conversations around issues related to the Ebola crisis, including public health, but also including public spending, where it was going, what it was being used for, asking them questions about whether they agreed or not with the use of that money, and built conversations and discussions around that as part of the response. In Liberia and Nigeria now, we are working with the leading rappers and music producers in both countries to create songs around these issues. So really trying to get creative about how you reach people and how you put out information in places where they are and meet them there rather than where you want them to be. If people don't have access to the internet, if they're not literate, and so on and so forth. And then building capacity, as I mentioned, not just for public financial management systems, but here in Pakistan, again, another interesting example, they're trying to procure all of these new ventilators, and the procurement process for those is critical. But there's a massive shortage of doctors and nurses who know how to use these ventilators. So even if the government procures them, there's still a big skills gap. So again, it's about building skills here and in many other places too, with the media, supporting them to understand this data, to interpret it, to communicate it to citizens in ways that will be useful. But finally, I think to find the opportunity in all of this, it seems to me like there is now the potential for a new consensus on fiscal governance issues in a way that there hasn't been, as far as I can remember, partly because the elites are now having to use the health systems that they have for many years gutted through their lack of tax and their corruption and their ability to fly to other countries to get healthcare services, which they're no longer able to do. And I'm beginning to hear some conversations about from people who previously would never have supported tax-paying or reform of fiscal systems about why this is so important and why this moment is one that could change fiscal governance more broadly. So it's an opportunity despite all of these challenges. I'll leave it there for now.
I am glad about the positive note at the end of this. Of course, every challenge presents an opportunity. And indeed, not everyone has the access to internet or are able to go into these online platforms. But something that you mentioned, and it's true, most of these websites that are meant to follow on resources for emergencies are not updated after 2-3 years. And many of the times it's because of the difficulty to gather the information, because the systems do not contain the information per se. And you mentioned that something that it's important to note here, and I would like to know about your thoughts of how can we go around this issue, because we're not going to be able to set up systems just because of the emergency right now in 2 months. Just because we want the data, the financial management information systems that have been being developed for the past 5 years, 3 years, some of them, and we still see models going and changes going on, but we still don't have the systems. We're not going to have them in 2 months. So what can we do in order to enable transparency and gathering the data in this context? So it's a difficult question, but probably Sailendra, Lindsey, you have some ideas on this.
Okay, great. Unmuting oneself is challenging in this context, but it means we're not going to interrupt or talk over each other, so that's a nice thing. Okay, so it really depends on where we're starting from. So we actually have a template that helps you kind of think through what systems do we have, where is information kept, is it entirely on paper, is it in Excel spreadsheets, is it in financial management systems, what are the different databases, the different structures that this information is already in. Obviously, we're in times of emergency, so planning like a huge systems upgrade, buying a new system, or doing a significant information technology project is probably not the highest thing on the list in this time of emergency, although it is a really good thing to think about for getting out of this emergency. But you can make a plan to basically identify the most essential pieces of information that you need, and to quickly be able to publish them via different technologies, different mediums, depending kind of as what Blair was saying, how important it is to get the information to people where they are. What I try to really emphasize is standardization is so important, just getting the data into a good format, because then different options for reuse become possible, right? You can take that information and build a dashboard, a performance dashboard. You can take that information and, you know, summarize it into a radio promo. You can take that information and use it different ways. But the more that the information is, you know, buried in documents, hidden in paragraphs, difficult to extract and repurpose, then, you know, you're going to become more limited in how quickly you can publish it, how quickly you can reuse it. So the more that it's kind of streamlined and standardized is for the best.
And as you know, that's something that we have been working on. And during the workshops that we're going to have with governments and civil society, we hope to achieve working towards standards of this information. You know, we have the open fiscal data package that has the data specification for budget and spending, and we have the open contracting data standard. We have on beneficiaries and on infrastructure projects, but there is so much more information in this case that needs that we need to have specifications of what data is actually required and gathering. And something that you mentioned, Blair, was the lines of responsibility to gather the data are important in responsibility. So I don't know if you have any insights from that point of view.
Yeah, I mean, I would 100% agree with Lindsey. I think the most important thing is standardization. Reporting on frameworks that already exist, you know, like the ERT, there are, you know, many others adhering to open data standards. And, you know, and then the data is usable. It can be brought together in different ways. It can be used by different types of people. But I think it's, you know, also at the country level about coordinating in meaningful ways. We all talk about coordination, whether it's within government agencies, whether it's between donors and governments, but rarely is it meaningful. And again, I think, you know, it's easy to say, but at some level it comes back to leadership, particularly by governments. I used to work for Ashraf Ghani, the president of Afghanistan, when he was finance minister after the fall of the Taliban. And he instituted a rule then where he said, if you're a donor, you cannot come into a particular sector unless you're putting in at least $30 million. If you can't do that, then we're not accepting your money, because it was just too difficult to coordinate all of these very small donors who are putting a few million here and there into very dispersed projects across multiple sectors. And, you know, so I think it takes a bit of pushback as well from people in positions of authority to say, you know, we need to be able to control this data. We need to be able to control this money. And there have to be systems for doing that. That doesn't mean, of course, that there isn't ample oversight from citizens and that it's not transparent. But if everyone does what they want, it's just going to be incredibly difficult to understand not only where the money's going, but what impact it's having and how we can learn and improve over time.
I've unmuted you all, the presenters, so that you can also interact in this part. And Sailendra, we're speaking a lot about data, and the IMF is doing some work on financial management information systems. And well, this could actually rock a bit or change a bit the way financial management information systems are developed or managed or thought about. Do you think this can create changes in the conception of financial management, or do you think that data is already there, or you see data should already be there, but we're not exploiting it correctly? Maybe.
Okay, I think one thing I will mention, I mean, you are right in the sense that in a short time, you cannot really change much in financial management information. But the simple thing perhaps you can do is what I said in my presentation, that ex ante classifying and grouping these types of expenditures is important. So if even if your budget classification chart of accounts you are unable to change in a very short time, but at least you can create an entity within the financial management information system, a dedicated grouping or entity. You can call it administrative entity or whatever, which most of the financial management information system allows to add a new agency, new entity, things like that. And you can tag all these expenditures to that, for classification purposes. And then whenever all the spending happens throughout the expenditure chain until the last point of payment, so it will all be classified as if it is going from that entity classification. So that will give you a little bit of that will help in grouping all these expenditures as they are all COVID-19 related. But if you have to go even further, deeper into more granularity, okay, all COVID-19 related expenditure, but how much of it is going for, let's say, buying medical equipment, how much it is going into, say, providing financial support to the vulnerable households. So that is going to be a little bit more challenging, but perhaps if those types of classifications, I would think, should exist in the chart. So what will then you can do, perhaps, and you can kind of superimpose the whatever you have captured in the chart of accounts to the system with this high-level entity classification, which groups all the COVID-19 related expenditures. So I think with the help of some key guys, I would think that get a kind of picture, but obviously it may not meet all the requirements, but at least you can get a broad sense of tracking these types of expenditures, reporting.
Which might break a bit with program budgeting and the targets. So, and the overall targets of the budget, right, Jason?
Right, so I think, look, I mean, as I said, I don't think the perfect should be the enemy of the good. So the key thing for me is whether we can tack on, I mean, Sailendra's kind of talking about how you piece together existing structures with new pieces of information. And I think, as I said, the thing about a well-structured program budget with performance framework would be that it anticipates the possibility that you, not even anticipates, it expects the possibility that you will not reach all of your targets, that you'll have to make changes during the year. There should be managerial flexibility to address crises and unforeseen events. And so what we anticipate, and this kind of relates to another point Sailendra made earlier about loosening ex ante controls but strengthening ex post controls, is that the point is not to hamstring the government from doing things. The point is to put information, collect as much information as possible at the outset, and then commit to collecting additional information as you go and having review processes where you explain why you were able to do what you said you were going to do, why you weren't able to do what you said you were going to do, what you learned, and how that's now changing your targets going forward. And that would already be a much more rigorous and robust use of these frameworks than it often happens. So, which is why I think there's, as much as there are weaknesses here and things are going to fall apart, there are also opportunities to actually strengthen this idea that we don't always know what we're doing at the beginning, but we commit to a review process in which we learn and we then justify why we weren't able to do certain things and are able to do other things.
So flexibility here in a sense. And we had a question beforehand from civil society from Namibia, and they were specifically wondering and preoccupied about changes in the budget process because of the COVID emergency. And wondering if this could affect in the future, like how do we get back to normal? When do we get back to normal? So these institutional changes that might be because of the emergency and become the normal after, let's say. And this happens with procurement, right? You have procurement that's for emergency, you have actions that are for emergency, and that doesn't mean that they are staying there forever. And so you must have seen that as well in some of the times, Sailendra, as well.
Mm-hmm.
So
yeah,
what can we say to our friends from Namibia on how to manage this?
okay, just to get a little more clarity. So changes in the budget process to bypass some of the traditional ways of getting approval of the budget, that is to
Mainly on the timing. So the time frames might be moved because the presentation of the budget proposal should be done around now at this time, before April in many cases in Africa. And the presentation of the budget is going to be changed in many cases. For example, in Nigeria, it was a change in that only this year they got to manage to come back to the normal date of presentation. And that could be a setback, a big setback for transparency.
Yeah.
Yeah.
I mean, what I would say that if this is done to enable rapid response, because they think that there is not enough time to go through the full parliamentary process of debate and approval, then this is more, it should be considered more like a temporary measure. And as I said, in the beginning, there are different ways of involving the parliamentarians creatively, even if we are not able to go for a full debate. Like I gave the New Zealand example where the government and the parliament agreed to set up a select committee of the parliament, wherein which has representation of the typical finance committee of the parliament, which generally analyzes the budget proposal, but also some of the members from the opposition, so that they have a voice in the committee, which is kind of deputized by the overall parliamentarians, that they can play the role of the overall parliament to quickly review the budget proposal, give views, and work with the executive and give implicit approval on behalf of the overall parliament as a temporary measure during this crisis. So there are different ways of doing this. One could be creative, but I think what is important is to involve in some way parliament. This should not be completely fast. And if there is a need for a change of process to shorten some of the steps, that should be temporary for this year until the emergency lasts, and should not be carried over to the future years. Future years should come back to the normal process of budget process. And on the other measures, which I think you highlighted, there is a broad issue. It's not just the parliamentary approval issue of the budget. Some of the measures, I think some of the speakers also referred to, because these measures are temporary, how to ensure that they are temporary, they do not continue for a longer period. Again, like if particular I will give one concrete example, like extra budgetary funds. Some countries are setting up dedicated funds, extra budgetary funds, to provide funding to fund some of the measures for this crisis. That you can consider a sunset clause. I mean, typically many countries don't do that, because once extra budget fund is set up, that remains forever, right? So you should have a clear sunset clause that this will be abolished after the end of this year, after the end of this crisis. That's one way of ensuring that. I mean, sunset clause also provide an opportunity if you need to continue. You have to review it when the sunset clause kicks in. So this is just an example. So you have to think creatively.
Yeah, indeed, it's very useful, because it's something that many countries are going to face right now, because many are about to start their budget process now. So it's sunset clause and involving parliamentarians maybe in a select committee. And that's also maybe for the case of South Africa, that they were mentioning that parliamentarians are off because of the crisis and not interacting as or doing the oversight right now as it should be the process. So select committees can be a way. Lindsey, I'm unmuting you. Yeah, you're on.
I just wanted to share one other example that might be helpful for this context. It's also from Canada, which the reason I'm using 2 Canadian examples is I live in Canada, I'm Canadian. So, and here I'm part of civil society in my volunteer time on open government issues on the Multi-Stakeholder Forum for Open Government in Canada. And this was a point of concern for civil society. You know, there's so many emergency measures being passed. You know, what are they? How can we make sense of them? How do we hold a government accountable for these different emergency measures? So what the government has done in response to civil society concerns is put all of the emergency measures and the constitutional rationale for them, all of the documents in one place on a Department of Justice website. And this is going to be really helpful for those of us who want to understand, okay, how does this affect the budget process? How is this going to affect all of these different things that we care about? And we can also follow up on when will these measures be reversed, or when will these measures be changed, or if we really like some of these measures, which of these measures do we want to advocate for continuing?
And hopefully afterwards we include in those websites the fiscal data as well to follow the measures and the money. But it's a good practice to compile all these norms. So we unfortunately do not have the chat right now, but this is a conversation that is just starting. I am sure that we were not able to discuss everything because we are just today seeing the budget side of it. We are not speaking about the macro and the stimulus and the implications on tax expenditures that we're gonna leave for another time as well. So keep posted, because that's a whole other side of this big conversation on implementing fiscal transparency measures for emergency responses. And so I want to thank you very much for your time, for being here, to everyone who was here. And please, if you have any questions, send it to me, send it forward to my email. We are going to be reviewing all your questions, and we're going to send them to any of the people here, or we're gonna answer them ourselves depending on that. But every question that you might have, it's useful for limiting and identifying all the data sets that we require for this time. I hope this session was interesting and useful for everyone here. I see a lot of people from government and civil society from many regions. I see people from Latin America. I see people from South Africa, from Kenya. I see people from Indonesia. So I am very happy. And from Georgia, Victor, I see you here from the country I'm in as well. So I'm very glad to have you all here. Thank you very much for your time. This is all for now, and see you soon.